OxfordHBT migraine therapy is an intervention method to be used when a warning sequence called a prodromal stage attack has been identified. It is important that the routine described is started promptly within 2 minutes of an attack starting. The sequence to be followed is of 10-second bursts of humming in a deep to mid tone. The note D is a guide to this sound. Each 10-second burst of humming is preceded by a deep breath and also followed by a similar deep breath to fill your lungs in a very particular way. This deep breath is taken through your nose to maximize the stimulus you give to your brain and organs, whilst this also strongly imprints the humming signal you are sending through to your brain. The University of Chicago first drew attention to the power of this form of breathing in December 2016. At the conclusion of 10 such 10-second bursts, you need to take 2 minutes rest, either sitting or resting with, for example, your hands on an item of furniture. At the overall completion of 3 sequences of 10 10-second bursts, you should definitely sit for 2, 3 or 4 minutes, as your lungs will be exhausted and you need at least this short period of rest to recover. You should now also be free of any migraine effects. However, if no such relief has occurred, this may be because your migraine was of the diffuse kind, i.e. not the simpler with aura kind. Diffuse migraine attacks do take longer to clear, and clear more slowly, but even they have usually gone completely after a doubling up of the HBT treatment, i.e. one more complete sequence of 3 sets of 10 bursts of humming. If you often wake up with a migraine. For those who are woken up by migraine, i.e. where the migraine has already developed extensively before you wake up, an alternative plan is a preventative approach. You use 1/3 of the standard model of 3 sequences each of 10 by 10 second bursts per evening before retiring to bed, in the form of 1 sequence of 10 by 10 seconds at times when you believe that you have entered into migraine mode. Clinicians involved in the clinical assessment thought that there was some evidence migraines were cumulative in their preliminary stages, and this might delay their progress. These ideas will be examined more closely in the forthcoming trials. The humming itself has to be performed in a particular way. First, close your lips, lightly touching, making an airtight seal, followed by bringing your jaws together but not clenched. Now, hum a mid-range tone. D below middle C is commonly used and works best. Humming should be firm and positive, but not necessarily loud. This will create a buzz in your mouth and nose, perhaps followed by a distinct and sharp tingle in your nose and tingling sensations in your face. This is a clear sign of a successful vibration pattern in your mouth cavity and skull that will successfully carry through an effective signal to your brain and stop that migraine in its tracks. OxfordHBT is a repeat treatment. That is, it can be used at any time it's needed to stop a migraine attack in its tracks, any time you feel an attack is coming on. Most people just continue to use the routine when needed, and some people are fortunate enough to dispel migraines for a very long time, sometimes years, and some have never experienced subsequent attacks of any kind whatsoever. We can be contacted at any time at mail@oxfordmigrainelabs.org. Thank you.